Okay, so the first question is, what is a dental veneer and how can they help improve my smile?
Right. So great question. We do a lot of veneers. I do a lot of veneers. They're a fantastic option for a lot of reasons. So a veneer is kind of like the term veneer. It's like a facing that goes over your tooth or teeth, which can improve color, improve shape, and also the orientation, or give it an illusion that they're straighter than what they actually are. So they're very simple to do typically, but they can be quite costly. So it does tend to be something that people ask about, yet still have a lot of questions when you start to talk about thousands of dollars to be spent. So I guess the first thing to say is that there's two types typically. So there's a ceramic veneer, and then there's also one called composite resin. So the ceramic one is the beautiful one. So it is the one that's highly aesthetic, very strong. However, it does have its downside. So it's very expensive usually. But then the other thing that can be quite a negative is you do need a certain amount of thickness of this material on your tooth to be able to give it all those properties that we want. And so it tends to need sometimes a lot of preparing into a tooth. So you take away a lot of good tooth structure to be able to do it. And sometimes that may not be appropriate or may not be wanted by the patient. So it's something to weigh up the advantages of the aesthetics and the strength versus that downside. For some people, it is really appropriate and it's fantastic because you don't need to prepare it at all. So if the teeth are positioned in a certain way, you can just put ceramic straight on there and you get all of those effects and you don't have to touch the tooth at all, which is just like the absolute win. So that brings me, I guess, more to the other option, which is resin. So resin is usually a composite resin. So they're typically a lot cheaper, maybe a third of the price, a third to a half of the price. They used to be a product which we would say wasn't as aesthetic, but there is, the great thing about dentistry is the products change so much and dentists get more and more skilled. We learn so much more, as the years go by in our careers and also university training. So what we're finding is these resin materials are getting extraordinarily great aesthetics as well, like sometimes even competing with a ceramic. And so this can be achieved and give you that cost-effective approach, but also you don't need to be as aggressive on the tooth to prepare it too. So it's interesting to watch this space as these resin materials get better and better and better, and whether the ceramics are going to start to phase out a little bit. But it's just amazing. Like I'm part of different forums of dentists and they display their work, and it's absolutely amazing. You see these resins versus ceramic and you can't tell the difference. So so I'm probably getting a bit bogged down in details here, but I guess the big things is it covers, typical dentist, it covers the face of the tooth. It can change the shape. It can change the color. It's usually done in sets of 2, 4, or 6. Like 6 is probably the more typical number of teeth to be done. And it's great, and it can transform your smile. Did I
Yeah, no, that was good.
Cover everything there, Beck? Yeah.
I think some other things that we often get asked is like how long do they last, and whitening. So obviously veneers are generally considered a very cosmetic type of service. And yeah, so I think maybe we should touch on that a little bit because, whitening tends to come hand in hand when you're doing like a smile makeover, and veneers are involved in that. So maybe we can talk a little bit about that because I think that's a good important element.
Yeah, absolutely. So sometimes if the veneer is very thin, you get the color of the tooth that can sort of come through the material. So sometimes it's great to get the absolute best result if you're wanting to go down the white sort of smile, bright smile. Then getting that whitening done first for the teeth that sit underneath the veneers is very important. But also because, when you look, like if you're getting 6 veneers at the front, there's still those posterior teeth that you do see in your smile. And so if you can brighten those up as well to match in with the veneers, it's just going to blend in absolutely beautifully. And even though occasionally veneers are done on lower teeth as well, by brightening those up in conjunction with the veneers can be really good, because some people, or most people, will show some element of their lower dentition when they smile. So it does tend to go hand in hand. The other thing, so you're talking about other alternatives or additions to veneers, is clear aligners. Invisalign is the really big one that probably most people have heard of. Sometimes it can be really important that the teeth are positioned in a better way to be able to enable the veneers to get the best result, and or enable us to not have to take away tooth structure to be able to get that result. So it might be something when you go in and you're discussing with your dentist, hey, I want to get these veneers, you'll probably find there'll be an element, or there'll be a component of that chat around, hey, should we go down the straightening road? Or in some cases, I'll often get patients come in and they're like, hey, I want veneers. And I'm like, well, you could actually get just as good a result, probably a better result, using your own teeth, reposition them. You don't have to touch the tooth. There's nothing there that's going to break as such. And it usually, in a lot of situations, will be more cost effective as well. So like the clear aligners, unlike your traditional braces, can be a fairly palatable way to straighten teeth for adults especially. So that there might be an element of either, hey, can we do this with aligners, or do we need to add aligners as well to a veneer case to get the best aesthetics?
Yeah. Because there is that element, like nothing lasts forever in dentistry, and so with both veneers and composite, whereas if you go down that path of straightening your own teeth, you're keeping that stability and strength without damaging the teeth. They're still your own teeth, so you don't have to replace any of that dental work down the track. Because with composites and the veneers, both options, what's the time frame, would you say, for both of those that people could expect? I know, how long's a piece of string?
Yeah, it's really hard, and it's very patient dependent. But I mean, I always say ceramic lasts longer. If you can get sort of 5-7 years out of resin veneers, you're probably doing pretty well. Ceramics should be kind of 10 plus, but I've seen ceramics and I've seen resin veneers last 15-20 years in some certain situations. Other people might have other risk factors that cause things to break, grind their teeth, or their bite's not quite right, in which case it can be quite a lot less. So I'm giving a really wishy-washy answer here, Becky, on purpose, because it really is case dependent. So yeah.
No, that's great.
Yeah. I think that was everything. Did I touch on price? I think.
No, you didn't.
No. Yeah. So once again, it really varies, on what practice you go to as to what's charged, and that's for various different reasons. But typically, around sort of $1,500 or $1,200 up to $2,000 per veneer for a ceramic. And you're probably looking maybe around half that cost for a resin. So you times those, do the maths, times that by 4 or 6, or in some cases, 8. So it can add up quite a lot. But I love doing veneer cases. You do get this beautiful result. Like it's a fantastic procedure for the right patient. So it's common, and it's very well very well received by patients that get it done.
Yeah. Yeah. And most practices offer like a cosmetic consultation, either low cost or rebate only, no charge even. So, if you are interested in finding out if veneers or composites or any of those options that Heath has discussed are a good option for you, contacting a practice and going in for a chat one-on-one with the dentist, where they can look at your specific, situation and give you, a bit of an idea of what you could expect and the results that you could get from either of those options, I think is probably the first step. Would you say, Heath? Yep. Yeah,
absolutely. And for this, it's a complex process to go through. It's expensive. You have to be really comfortable with who you're seeing, be very selective, and it's not about, there's bad dentists and good dentists, but I think it's just, finding someone who you connect with and you feel that they're addressing your concerns, they're hearing you, so you're going to kind of get what you want at the end, because it's, there's nothing worse than spending all of that money and going through that whole process, and you have such high expectations, and fair enough too, than to get to the end and not be happy. So I think it's, you know, this in particular, it's so important to find someone that you're going to be comfortable with doing this sort of work on you.
Yeah, absolutely. Okay, you kind of almost gave us one of your tips, which you're going to go through in a little bit later, but anyway.